Good afternoon, everyone. My name is Jeremy Craig. I'm going to be performing a newborn assessment on a newborn that's only a few hours old. So the first thing that I'm going to do, I'm going to provide privacy. I'm going to make sure that I provide hand hygiene in front of the mother and anyone else in there. I'm going to also ask the mother for her name and also just the name of her baby and check the birthdays and also check the wristbands as well. I'm going to tell the mother that I will be performing a newborn assessment. So the first thing that we are going to be doing is that we are going to be checking the vital signs. So what I'm going to be doing is that I'm going to be checking the apical heart rate. So I have my stethoscope right here. I'm going to make sure that I disinfect the diaphragm and the earpieces of my stethoscope. So I'm going to then find the sternal notch, find the loop, the angle of Louis, and then go down to the second intercostal and then palpate until I get to the fifth intercostal. I'm going to find the midclavicular line, and then I'm going to listen to the heart. I am then going to listen to the heart for 1 full minute, and the average beats is between 120 to 160 beats per minute. If it's sleeping, they're going to have less than 100, and if they're crying, they'll be over 180. You're also going to want to listen to the heart sounds. You should hear a regular heartbeat. You could hear murmurs, but that's common for newborn babies. So after listening to the heart sound for a minute, I'm then going to move over to the lungs. So like always with the lungs, I'm going to go to each quadrant within the lungs. So starting at the aphyses, you're going to listen for a minute. It's not irregular for an infant. You can have pauses in breathing. You can have shallow respirations. You can have asymmetrical chest when they're breathing. And then for the regular rate for an infant would be between 30 and 60 breaths per minute. So then I would go to each different lobes going down, because you want to make sure that you check every single lung. It is also common to hear crackling in the lungs because there's still some of the lung fluid that's still within the lungs that eventually will move into the interstitial phase. So there are also 4 signs. Some signs of respiratory distress would include refractions of the chest. You would also have cyanosis or blue lips. You would also have flaring of the nose. You could also have grunting of the baby. You could also have difficulty breathing as well, or tachycardia. So you're going to have respirations over 60. And then next, I'm going to be checking the temperature for the newborn. So we have our thermometer right here. We're going to check axillary. And then we're going to be wanting to see a temperature between 35.5 degrees Celsius and 36.5 degrees Celsius, which is a normal temperature for a newborn. So we just took our temperature. It was 36.5, which is fantastic. So next we're going to be moving on to the general assessment. So next I'm going to be assessing my newborn's skin. So as I'm looking at the newborn, you want to make sure you check head to toe. My newborn is pink. They do have presence of acrocyanosis on their hands and feet, which is a normal finding with a newborn. My newborn is alert, quiet, and they are active. Okay. Also noting my newborn, they are also covered in the Vernix kikosa, which is a normal finding. That is the white substance that comes out after birth. I also checked for lanugo and also milia. So then after that, we're going to be checking the head. So we're going to be checking the anterior fontanelle. You want to make sure that it is flat and soft. So then moving back, you're going to check the sutures. You want to make sure that the sutures are open. And then finally, when we get to the posterior fontanelle, we want to make sure that it is also soft and flat. It will be smaller than the anterior fontanelle. Also, when you're assessing your newborn's head, you also want to see if they have cephalohematoma and caput secundum. So I probably did not do well with the pronunciation, but cephalohematoma is when there's going to be pooling of blood between the scalp and the periosteum of the skull. So you'll have blood in there. And then the caput secundum is when there's edema within the head. Okay, so next we're going to be moving on to the bowel sounds. So like I said, we're going to make sure that we clean the earbuds and the diaphragm of our stethoscope. So then we're going to check for bowel sounds in all 4 quadrants. You want to make sure that you check twice. Okay, so we have bowel sounds present in all 4 quadrants. So then with that, we're going to be moving on. We're going to be checking the umbilical cord. So checking the umbilical cord, you want to look for the 3 vessels, AVA. So there's going to be 2 arterioles and 1 vein. We're going to want to make sure that we clamp it tight. And then we want to make sure that the cord is dry and that it's going to be above the diaper as well. You also want to make sure there's no signs and symptoms of infection. So when it comes to male and female genitalia, the female genitalia, the labia majora is going to be covering the clitoris and the labia minora. It also might have white discharge as well. So when you have a boy, you're going to be checking the testes. You want to check the positioning of the meatus. It is called hypospadias. So it is it's pretty much when it is above the testes or when it's under the testes. Okay, so then moving on, we are going to be checking for newborn reflexes. So the first one we're going to be checking is for Ehrlich Moro. So then with that, it's when the newborn is going to be the most dramatic, and pretty much is that when the arms and the legs are going to be extended above the newborn. Next, we're going to be checking for their grasp. So it's when you lay your finger out and then the newborn is going to grasp onto your finger. Next, we're going to be rooting. So we're going to tick our finger. Of course, we're going to be wearing gloves. I don't know if I mentioned that earlier, but you also want to have gloves after your hand hygiene. So then with rooting, we're going to take our finger, put it into the infant's mouth, and they're going to grasp on it. So then we're going to do the Babinski. So you take the newborn's foot, and then you just go lateral, and then you see with their foot. And then finally, we're going to be the stepping. We're going to pick up our newborn, and then they are going to seem like they are walking on their own. Moving on, we're now going to go to the teaching aspect for new parents. So for safety guidelines, we're going to go with ABC. Alone, on back, in your crib. So when you have a newborn, you want to make sure that there's nothing in the crib. They're going to be placed on their back because you want to be able to prevent SIDS, sudden infant death syndrome. So you want to make sure that when the baby is in the crib, they're on their back and there is nothing else in there. So moving on, I'm going to teach how to use a ball syringe. So you would use a ball syringe when the newborn has secretion still stuck in their mouth. So what you would do, I have this syringe. So you would turn the infant to their left side, so then all the secretions would pocket into their left side of the pocket of their cheek, and then you just go in, and then you would suck up all the secretion. So when it comes to umbilical cord care, we're going to want to keep the cord dry by keeping it outside the diaper. The cord will eventually fall off within a few weeks. So then moving on, I'm going to talk about breastfeeding. So when it comes to breastfeeding, the newborn, sorry about that. Within the first day, the newborn is going to drink between 15 to 30 mLs of formula or breast milk. You want to make sure that they are going to be. You want to make sure that the newborns are going to be getting breast milk or formula. You would want to talk to the mother about which one they're going to be doing. So moving on to expected output, the newborn should have between 1 to 2 wet diapers for the first few days, and then moving on, they should have about 6 a day by day 6. So then moving on to stool output. So the first stool that they're going to have is something called meconium. It's going between the first 24 to 48 hours. It's black to a dark green, and it's very sticky. So then moving on from meconium, we're going to have transitional stool. Transitional stool is going to be like a yellow to a greenish. It's very seedy. It's got a sweet odor to it. So that's going to be between 3 and 6 days. And then after that, we're going to have milk stools after the 6th day, which are going to be like a yellowish to like a white, to like a yellowish to a brown color. And its consistency could be liquidy, depending if the baby is being breastfed or by formula. So then moving down from stool, when it comes to weight loss, the newborn is expected to lose about 10% of their weight because of meconium. They can also lose it because of any kind of secretions that are still in their body. So it's expected that the newborn will lose some weight. And then once they start breastfeeding or formula, they will gain weight after that. So 4 signs and symptoms that you would want to report to a pediatric nurse practitioner is that if they still have cyanosis or jaundice after about a week, if there's any kind of grunting or nasal flaring as well. Also, if they have not been able to pass a bowel movement after a certain amount of few days, or if they're not voiding, that could lead to a bowel obstruction, meconium obstruction, or they're not able to urinate. So moving along from there, I'm now going to be talking about 3 of the following newborn medications that are given to a newborn. The first one is vitamin K. It's given for blood clotting. So when a newborn is born, they have a very sterile gut. So when they are injected with vitamin K, it will allow them to start having bacterial flora going on. So then they're able to have bacterial in their stomach, not to mention with the blood clots as well. They're given a hepatitis B vaccine, which will prevent them from getting hepatitis B. And then there's the uromycin ointment, which is then given on their eyes so it can prevent infection within their eyes. And then when it comes to how to demonstrate, so I'm now going to demonstrate to handle a choking baby. So what you're going to want to do is you're going to take your infant, make sure that you support the head, and you want to pat on their back until you're able to withdraw whatever the newborn is choking on. And then finally, you're going to want to be able to place the baby in a comfortable position with the mother so you can have skin-to-skin contact. You're going to want to make sure that the head is resting very nicely on the mother so that you can have that skin-to-skin contact. And that was a newborn assessment for a newborn.